I'm Lygia Ricciardi. Welcome to the Digital Health Live Studio at CES 2019. I'm here speaking with Dr. Levy, who's the Chief Medical Officer at Teladoc Health. Welcome, Louis.
Thanks so much. Great to be here.
So, first question for you. I'm familiar with Teladoc. Can you tell me about your name change to Teladoc Health?
Yeah, so we recently changed our name from Teladoc to Teladoc Health. And the reason for that name change was really to highlight that we've come a long way from where we were several years ago when we were very much focused on acute episodic care in the US. With the acquisition of Best Doctors in 2017 and the acquisition of Advanced Medical in 2018, we are now creating a digital front door globally. So we provide a comprehensive range of virtual care services around the globe. So much more than virtual urgent care in the US. And that was the reason for the name change from Teladoc to now Teladoc Health.
So a real geographic expansion, as well as it sounds like perhaps in types of service or types of care offered?
Correct. So we really want to create a consumer experience that individuals can see us as the digital front door. And what we have seen through our own efforts is that virtual care has crossed the point of inevitability. That, as they say, the future is here because we are seeing increasing uptake of individuals accessing our services around the globe. So just like in many other areas of consumerism, individuals are now realizing that often if you have a medical problem, the place that you may need to go may be a virtual spot, not a physical spot.
And how do you connect into other types of care services in terms of, directing patients after a virtual experience to seek care somewhere else? How do you connect to networks of physically based providers?
So I think that there are two very important connection points. Virtual care really represents the ability to democratize access to great medical care. Great medical care being high medical quality, compassionate, cost-effective, culturally appropriate. And that connection between the consumer and the virtual delivery system is very, very important. And what we've been able to do is create a very large array of services, but also the navigational piece through light AI on the front end so that individuals who are coming into our system know which service they can quickly access, and we're not confronting them with, you could do one of these 50 programs. But equally important is that integration into the traditional healthcare setting, because we know over time individuals are going to need to access both virtual care as well as care within the physical setting.
How much of the care you provide would you say fits into the general category of prevention and wellness and kind of maintenance of health as opposed to helping people deal with acute specific episodes?
It's a great question, and it's also a hard one to answer because for example, at the conference I just alluded to a patient that had accessed Teladoc Health because he was having a little bit of chest discomfort, thought he had a cold, thought he pulled a muscle, had a little shortness of breath. Well, the individual clinician in Nashville, Tennessee, identified that this individual might in fact be having blood clots to the lung, which are life-threatening, and said, you really need to get care right now. And fortunately, he did get care, and he was having blood clots. So it was a great pickup by the clinician to get that individual. So what did he prevent? He prevented this individual from potentially dying from a pulmonary embolus. So I would say that when we think about preventive care, we should not just commingle that word with wellness, because I think that preventive care can often be care that is proactive, easily accessible, and really getting at situations before they become large problems like complicated blood clots to the lung.
Absolutely. Well, that's a really impressive story.
Thank you.
Thank you, Louis. This is Lygia Ricciardi at the Digital Health Live Summit, sponsored by Living in Digital Times. Thank you so much for joining us.
It's been a pleasure. Thank you.